Tonight, while you are sleeping, something may be happening inside your body that you will never feel until it is too late. Every year, hundreds of thousands of adults over 60 suffer heart attacks and strokes while they are fast asleep. Not from rare disease, not from bad luck, from specific nighttime habits they perform every single evening, believing they are completely harmless or even healthy. Your heart does not rest while you sleep. It is supposed to enter a state called the dipping phase, where blood pressure drops, heart rate slows, and your arteries use the quiet hours to repair the microscopic damage from the day. This is the only recovery window your cardiovascular system gets in any 24-hour period. When specific nighttime habits prevent that dipping phase from occurring, your heart spends 8 hours under the same pressure it faces during your most stressful waking moments. Your blood pressure does not drop. It spikes. Your heart rate does not slow. It races. And you are completely unconscious while it happens. If your blood pressure does not dip at night, your risk of a stroke in the early morning hours increases by more than 400%. This is not a theoretical risk. It is the single greatest measurable predictor of cardiovascular events in people over 60, and most of the habits that cause it feel completely ordinary. I'm Dr. Jake Taylor. Today, I am counting down the 5 most dangerous nighttime habits for your heart and brain, starting with the least severe and ending with the one that is silently operating in millions of bedrooms right now. For each one, I will give you the exact biological mechanism, the research behind it, and a specific correction you can implement tonight. Write your country in the comments. And if you eat within 2 hours of bed, sleep in a warm room, or take your blood pressure medication in the morning, stay with me because at least one item on this list almost certainly applies to you. Why your heart is most vulnerable while you sleep. Before we count down the 5 habits, you need to understand what is supposed to happen to your cardiovascular system during sleep and why the aging body makes the nighttime hours specifically dangerous when these habits are present. After 60, your cardiovascular system has lost a meaningful amount of its youthful resilience. Your arterial walls have stiffened. Your body produces significantly less nitric oxide, the compound that keeps arteries relaxed and blood flowing smoothly. Your autonomic nervous system, which regulates the transition between waking cardiovascular activity and nighttime recovery, responds more slowly and less completely than it did at 40. These changes mean that the nighttime dipping phase, the window of reduced blood pressure and heart rate that allows arterial repair and cardiac recovery, is already harder to achieve after 60 than it was in younger years. The habits I am about to describe actively prevent it from occurring at all. When the dipping phase fails to happen, your heart spends the hours of darkness under sustained pressure that it was designed to experience only temporarily. The arterial repair work that should be occurring does not. The inflammatory compounds that accumulate during waking hours are not cleared. And your cardiovascular system enters each new day carrying the unresolved burden of the previous night. This is why these habits compound. A single night of disrupted cardiovascular recovery is manageable. Years of it, accumulated through habits that feel entirely routine, creates the conditions for cardiac events in people who believe they are doing everything right. I want to say something directly before we go further. This channel exists because there is a gap between what the research shows and what most people over 60 are actually being told at their medical appointments. Every week I hear from people who have been managing serious cardiovascular risk for years without ever being told about the nighttime factors we are discussing today. If what you have heard so far is useful to you, please subscribe right now. It takes 3 seconds. We publish every week specifically for people over 60 who deserve direct answers rather than reassurances that everything looks fine. Hit subscribe and let's keep going. This is the habit that generates the most resistance when I raise it in clinical settings, because warmth feels safe and comfort feels restorative. But for your cardiovascular system during sleep, a warm room is the opposite of rest. Here is the mechanism. To enter deep restorative sleep, your body's core temperature must drop by approximately 2 degrees Fahrenheit. This temperature drop is not a side effect of sleep. It is a prerequisite for it. Your blood vessels dilate to release heat through your skin. Your heart rate slows. Your blood pressure begins its nighttime descent, and your body transitions from the sympathetic nervous system dominance of waking life into the parasympathetic state where cardiovascular repair occurs. When your bedroom is too warm, your body cannot release heat efficiently through your skin. Your heart must compensate by pumping more blood to the surface, beating faster, maintaining higher pressure. Instead of entering cardiovascular recovery mode, your heart is functioning as a cooling system for 8 hours while you believe you are resting. The cardiovascular ideal for bedroom temperature is between 65 and 68 degrees Fahrenheit. This range allows the core temperature drop that initiates deep sleep, enables the blood pressure dip that protects against stroke, and supports the production of melatonin, which beyond its sleep function acts as a direct antioxidant protecting heart muscle tissue. The opposite extreme matters equally. A room that is too cold causes arterial vasoconstriction, the narrowing of blood vessels in response to cold that spikes blood pressure and increases clot risk. The 65 to 68 degree range is the physiological sweet spot, not an arbitrary number. If you currently sleep in a room at 72 to 74 degrees, dropping the thermostat by 5 to 6 degrees tonight is one of the simplest and most immediate cardiovascular interventions available to you. If you are concerned about feeling cold, warm socks or an extra blanket at the foot of the bed warms the extremities while allowing the air temperature to remain at the protective range. Dorothy was 70 and came to my practice reporting persistent morning fatigue despite what she described as adequate sleep. Her resting heart rate was elevated, and her morning blood pressure readings were consistently high despite evening medication. When I asked about her sleep environment, she told me she kept her bedroom at 74 degrees year-round because she had always felt cold at night. We made one change, dropped the bedroom to 67 degrees and addressed her cold sensitivity with warm bedding rather than room temperature. Within 2 weeks, her morning blood pressure readings had improved measurably, and she described her sleep as deeper than it had been in years. "I cannot believe the temperature of a room made that much difference," she said. Habit number 4, going to bed dehydrated. This habit is particularly common among people who are actively trying to protect their health. Many people over 60 deliberately restrict fluid intake after early evening specifically to avoid nighttime bathroom trips that disrupt sleep. The logic is understandable. The cardiovascular consequence is serious. Your blood is approximately 90% water. When you are dehydrated, blood volume decreases while the solid components, cholesterol, platelets, calcium, inflammatory proteins, remain at the same concentration. Your blood becomes thicker, more viscous, and slower moving. For an aging cardiovascular system already working with stiffer arteries and reduced nitric oxide production, thicker blood creates dramatically increased friction against arterial walls. This friction drives inflammation. Inflamed arterial walls accumulate plaque. Thicker, slower blood creates the conditions for platelet aggregation, the clumping of platelets that forms clots. Throughout the night, you continue to lose fluid through every breath you exhale as water vapor and through perspiration. If you begin the night already mildly dehydrated, by the early morning hours your blood has reached its maximum viscosity. This is the biological reason why the highest concentration of heart attacks and strokes occurs in the hours just before dawn. The blood is at its thickest, slowest, and most clot-prone precisely when cardiovascular demand increases as the body prepares to wake. The solution is not flooding your system with water immediately before bed, which will interrupt sleep with multiple bathroom trips and negate the sleep quality benefit. The solution is steady hydration through the day with a small amount, approximately 4 ounces of water, 1 hour before bed. 4 ounces 1 hour before sleep allows the fluid to be processed before deep sleep begins, maintains blood viscosity through the night, and does not typically require a bathroom trip at 3 a.m. The timing is the intervention. George was 74 and had restricted his fluid intake after 5 p.m. for years on the advice of a urologist managing a bladder issue. His morning blood pressure readings were consistently elevated, and he had experienced 2 episodes of nighttime leg cramping severe enough to wake him. When I connected his hydration restriction to the viscosity mechanism and suggested the single small glass 1 hour before bed as a compromise, he was skeptical. Within 3 weeks, the leg cramping had resolved and his morning blood pressure had dropped by 7 points. His urologist was contacted and confirmed the small pre-bed amount was acceptable. "Nobody ever explained to me that my blood gets thicker through the night," he said. "I thought I was being careful. I was actually making things worse." Habit number 3. Sleeping on your back with no elevation in the presence of sleep apnea. Many people know they snore. Far fewer understand what that snoring is doing to their cardiovascular system every single night while they sleep through it. Sleep apnea is not a snoring problem. It is a repeated oxygen crisis. Every time your airway closes during sleep and breathing stops, the oxygen level in your blood drops. Your brain, sensing oxygen deprivation, triggers a massive adrenaline release to force your body awake enough to resume breathing. In that moment, your heart rate jumps from its resting level to 120 beats per minute or higher in seconds. Your blood pressure spikes to levels that would concern a physician if they were measured in a clinic, and this can occur 20, 30, even 50 times per hour through an entire night of sleep. Each episode scars heart muscle tissue. Over months and years, the walls of the heart thicken and stiffen in response to the repeated pressure surges. The most dangerous outcome of chronic untreated sleep apnea is atrial fibrillation, a loss of coordinated heart rhythm where the upper chambers of the heart quiver rather than pump effectively. When blood pools in quivering chambers, it forms clots. Those clots travel to the brain and cause strokes. Research has directly connected untreated sleep apnea to a significantly elevated risk of atrial fibrillation, and atrial fibrillation is responsible for approximately 1 in 4 strokes. Back sleeping worsens apnea dramatically because gravity allows the tongue and soft tissue of the throat to fall backward into the airway when you are supine. A body pillow that keeps you on your left side during sleep can reduce apnea episodes significantly without any device. Elevating the upper body 15 to 20 degrees through a wedge pillow or bed risers opens the airway further and reduces the frequency and severity of obstructive episodes. If you wake consistently tired despite adequate sleep hours, if your partner reports pauses in your breathing, or if you experience morning headaches, these are the clinical indicators of sleep apnea. A sleep study is the appropriate next step. The inconvenience of a CPAP machine is considerably less than the cardiovascular consequence of leaving this condition untreated across years. Robert was 72 and had experienced 2 episodes of atrial fibrillation in the preceding year. His cardiologist was managing the rhythm problem pharmacologically but had not asked about sleep. When I reviewed his history, he described waking fatigued regardless of how many hours he slept, and his wife confirmed he stopped breathing regularly during the night. A sleep study confirmed moderate sleep apnea. CPAP therapy was initiated. Over the following 6 months, his atrial fibrillation episodes dropped to 0. His cardiologist described the improvement as remarkable. Robert told me, "I had no idea the snoring was connected to the heart rhythm. Nobody made that link for me until now." Habit number 2, taking blood pressure medication only in the morning. This is the habit on this list that has the most direct and most immediately correctable cardiovascular consequence, and it is a habit that millions of people follow because their doctors gave it to them. Here is the problem. For most adults over 60, the most dangerous blood pressure readings of the entire day do not occur during stressful waking moments. They occur during sleep, specifically during the REM phase when the brain is highly active and the autonomic nervous system produces episodic cardiovascular surges. The early morning hours between 2 and 5 a.m. represent the period of peak cardiovascular risk for this reason. Blood pressure that should be at its lowest is instead spiking repeatedly. Arterial walls under pressure during sleep sustain damage that accumulates across years. When blood pressure medication is taken in the morning, the drug concentration in the bloodstream peaks during the day and begins declining in the hours when cardiovascular protection is most needed. By the time the high-risk window arrives, the medication's effect may be substantially reduced. Large-scale clinical research has demonstrated that for a specific group of adults over 60, moving blood pressure medication from morning to evening reduced the risk of a fatal cardiovascular event by nearly 50%. The same medication, the same dose, the same patient. Only the timing changed. This is not a recommendation to change your medication schedule without speaking to your physician. Some medications, particularly diuretics, should remain as morning doses to avoid sleep disruption. But the question of medication timing is worth raising with your doctor explicitly. Ask directly, based on my blood pressure pattern and sleep, would evening dosing be safer for me? This conversation has the potential to be one of the most consequential medical discussions you have. Before we continue to the most dangerous habit on this list, I want to stop for a moment. If you have watched this far, you are the kind of person who takes their health seriously. That matters enormously. I want to be honest with you about something. This channel is small. We put significant work into researching and presenting information that most people over 60 are genuinely not getting from their medical appointments, and our subscriber count does not yet reflect the size of the audience that needs this information. If this video has given you something useful, subscribing right now is the most direct way to help us reach more people who need it. It costs nothing. It takes 3 seconds. And it genuinely makes a difference to whether this information finds the people who need it. Please subscribe, and let's finish this together. Habit number 1, eating a heavy meal within 3 hours of sleep. This is the most widespread cardiovascular risk habit on this list. It is practiced nightly by millions of adults who believe a satisfying dinner is a healthy one regardless of timing, and its effect on the nighttime cardiovascular system is the most directly documented of anything we have discussed. Here is the mechanism. Your body contains approximately 5 liters of blood. Digesting a large meal requires a massive redirection of that blood supply to the digestive system. Your stomach and intestines demand significant blood flow to break down food, absorb nutrients, and manage the metabolic work of a full meal. When you eat and then immediately lie down to sleep, you create a direct physiological conflict. Your digestive system is pulling blood one way. Your heart is attempting to enter its low-power nighttime recovery mode. The two demands are incompatible. Your heart rate cannot drop to its resting state because digestion requires sustained cardiovascular output. Your blood pressure cannot enter its nighttime dip because the body's physiological state is fundamentally that of active work, not recovery. The medical term for people whose blood pressure does not drop during sleep is non-dippers. Research has established that non-dippers face more than 4 times the stroke risk of those whose blood pressure follows the normal nighttime pattern. And late heavy eating is one of the most consistent and correctable causes of non-dipping in otherwise healthy adults. Beyond the blood pressure mechanism, late eating triggers an insulin spike that suppresses growth hormone production during sleep. Growth hormone is essential for the repair of arterial walls and heart muscle tissue during the night. When insulin is elevated, this repair process is compromised. Your heart is working harder while simultaneously losing its capacity to fix the damage from the day. There is a compound effect that most people never consider. The foods most commonly eaten as late meals or evening snacks, refined carbohydrates, salty foods, processed options chosen for convenience at the end of a tired day, each carry their own cardiovascular consequences that combine with the timing damage to create a compounded overnight burden. Let me tell you about Margaret. She was 67 and had been managing blood pressure with medication for 3 years. Her daytime readings were controlled, but her doctor had flagged a pattern of elevated morning readings, specifically the 7 a.m. measurement immediately after waking, that the medication was not adequately addressing. She had been told her dose might need to increase. When I reviewed her daily habits, her dinner was consistently at 8:30 or 9 p.m. and she was in bed by 10:30. She had never considered the connection. I asked her to make one change, move her main meal to 6 p.m. and limit anything after that to a small piece of fruit or a handful of nuts if genuinely hungry. 4 weeks later, her morning blood pressure readings had dropped by 11 points. Her physician held the medication increase. She told me, "I had no idea when I ate mattered as much as what I ate. Nobody told me that in 3 years of managing this." That was not a medication problem. That was a timing problem, and it was completely correctable. The practical guideline is clear. Your last substantial meal should be completed at minimum 3 hours before your target sleep time. If you go to bed at 10 p.m., your kitchen should be effectively closed by 7 p.m. If genuine hunger arises after that point, a small piece of fruit, a handful of walnuts, or a small portion of plain yogurt are options that do not create significant digestive demand. The test is whether the food requires substantial metabolic work to process. If it does, your heart will be doing that work while you should be recovering. Your complete heart-safe evening routine. Everything described in today's countdown can be addressed through a consistent evening routine that takes no additional time and requires no equipment beyond a wedge pillow and a thermostat adjustment. Beginning 3 hours before bed, your last substantial meal should be complete. If you take blood pressure medication and have discussed evening dosing with your physician, this is when that dose is taken. Begin winding down stimulating activity and screen exposure. 1 hour before bed, a small 4-ounce glass of water. Check that your bedroom thermostat is set between 65 and 68 degrees. This single temperature adjustment may be the most underappreciated cardiovascular intervention available without a prescription. At bedtime, position yourself on your left side with a body pillow behind you if you tend to roll onto your back. If you use or have been recommended a CPAP device, this is non-negotiable. Upper body elevation of 15 to 20 degrees through a wedge pillow dramatically reduces both sleep apnea episodes and nighttime blood pressure spikes simultaneously. In the morning, do not stand up immediately upon waking. Sit on the edge of the bed for 1 to 2 minutes first. Move your ankles in circles. Take several slow, deep breaths. Let your blood pressure stabilize before transitioning to upright. The period immediately after waking is when blood pressure rises most rapidly, and the combination of horizontal to vertical transition with elevated morning cortisol creates a cardiovascular vulnerability window. Giving your body 2 minutes to adjust is a genuine protective measure. The timeline of results. Within 3 days of correcting the room temperature and late eating habits, most people notice deeper sleep and improved morning energy. Within 2 weeks, home blood pressure monitoring typically shows measurable improvement in morning readings. Within a month, the cumulative effect of consistent nighttime cardiovascular recovery produces changes that appear in clinical blood markers at your next review. 3 mistakes that undermine everything. First, changing one habit while maintaining the others. These 5 habits compound on each other. Late eating elevates blood pressure that the wrong medication timing fails to cover. In a room too warm for cardiovascular recovery, with blood thickened by dehydration, while sleep apnea creates repeated oxygen crises through the night. Addressing all 5 creates a compounding benefit in the same direction that addressing one cannot produce alone. Second, expecting immediate results and abandoning the changes before the timeline of benefit arrives. The cardiovascular system responds gradually to consistent conditions. The repair work that begins happening during properly supported sleep accumulates across weeks, not overnight. Third, treating this as information rather than action. The habits described in this video are operating tonight in your bedroom regardless of whether you change them. The decision is whether they operate in your favor or against you. Your heart has been beating without rest since before you were born. Every single second of your entire life. It has never asked for more than the conditions to recover during the hours you are not asking it to perform. Those conditions are available to you starting tonight. Leave a comment below telling me which of these 5 habits you recognized in your own evening routine. Your comment helps other people in this community identify the specific habits operating in their own lives and understand that there are direct practical corrections available to them. If this video gave you something useful, share it with someone over 60 who goes to bed right after dinner, sleeps in a warm room, or has been told their morning blood pressure readings are too high despite medication. That conversation could change the direction of their health without them ever needing to change what they take, only when and how they sleep. I'm Dr. Jake Taylor. Subscribe if you have not already. Take care of yourself, and I'll see you in the next video.